Chris's patient is a 20-year-old black and white ruffed lemur, which has lived at the zoo for 6 months.
We don't get a lot of lemurs rolling up to the clinic in Bondi, so seeing lemurs is a rare event for me.
So, Chris, this is Stephanie and her partner, Sahala.
Okay.
And this is their keeper, Danielle.
G'day.
Hi, nice to meet you.
Hey, how you going?
So I've got a zoo to run, mate. I'm off, leaving Danny's capable hands.
Thank you, thank you. So, a sore tooth.
Yeah, so a couple of months after Stephanie arrived here, I started to notice that her tooth is getting a little bit brown, just from what you could see hanging out of her mouth.
Yeah.
Since then, it has developed a bit more. Her entire tooth appears to be brown.
Any chance of actually having a look at it up close?
Well, she does let me look. Hopefully she's in a good mood with us today, so she'll let us have a little look. We'll have to see what she says when we go in there, I guess.
The concern is that the tooth is badly infected. If Stephanie is in pain, it'll be hard for Chris to get close enough to treat her.
Lemurs are highly temperamental. They can be aggressive. They decide who they like, and they tend to stick with that opinion. If this lemur doesn't like me, this isn't going to go well. All right, so which one's she?
So this is Stephanie over here, and this is Sahala, her partner.
At the Halls Gap Zoo, Chris needs to get a closer look at Stephanie the lemur's tooth to decide if she needs treatment.
So which tooth are we worried about?
So it's on her left side. It just looks unhealthy compared to the others. There is obviously something wrong. We're just not entirely sure what the issue is just yet.
All right, so we need to have a look at her. How do we do that?
One sneaky way of doing it is give her a little treat and then try to lift up the side really gently with your finger.
Do you mind if we just have a little, a look in there? It's clear, isn't it? She wants the food, but she doesn't want the examination.
Yeah.
Each time I get anywhere near that tooth, she's just pushing me away. She's doing what everyone wants to do to the dentist. She's just smart enough to do it.
Try and hold on really hard.
Oh, a little look there. No, don't push me away. Thank you. No.
An untreated infection could be life-threatening, but Chris can't get close enough to examine the tooth.
The big problem we're facing here is that everything in this enclosure is in Stephanie's favour. What we need to do is turn things around so they're more in our favour, so we can actually look at that tooth. The only way to do that is to get her inside a pet pack and take her to the vet clinic. I get the occasional sneaky little look in there. I can see that tooth is brown, so it is worth looking at.
Yeah, definitely, I agree. The only thing is there's a possibility that she's pregnant. So we saw them mating quite a lot about a month ago, and it's kind of stopped since then.
Okay.
So
anything we do has to take into consideration.
Exactly, we have to be careful.
Yep.
Yeah.
All right. With numbers for these lemurs fairly limited, her being pregnant would be good news. But the complication here is that she has that bad tooth that may need an anaesthetic to have it removed. Anaesthetics and pregnancy don't mix well. Almost there, girl.
Chris, along with keeper Danny and Stephanie the lemur, have arrived at Hamilton Animal Health Clinic, 90 minutes from the Halls Gap Zoo.
All right, so she's travelled pretty well, Nat.
Great.
Now, obviously the main concern is this tooth.
Yep.
But, as Danny told me, the other concern is the fact she might be pregnant.
Oh, okay.
Dr. Natalie Roadnight will assist Chris with Stephanie's ultrasound. Chris needs to find out if the lemur is pregnant before he can do anything about her problem tooth.
Sorry, darling. Good girl, Steph.
Thanks.
If Stephanie is pregnant, it's critical she's under anaesthetic for as little time as possible. The longer she's knocked out, the greater the risk to her unborn young.
So I'm just doing a bit of a sweep through her belly now. Just looking for any, fluid-filled sacs that would indicate she's pregnant. Sometimes looking at ultrasounds can be quite tricky. It can be like looking at a fuzzy TV screen, but in this situation, it should be easy because a pregnancy should show up as a black ball, if it's there. I can feel her bladder right down the end, but moving forward to where her uterus is, I'm not feeling a lot. Okay, so going on what I'm feeling and what I'm seeing, I don't think she's pregnant. Danny does actually seem okay with the news, and I'm sure a large part of that comes from the fact that with her not being pregnant, it means if we do need to operate on this tooth, we can.
With Stephanie all clear to remain under anaesthetic, Chris can now safely examine that tooth.
Okay, so you're certainly right about it being discoloured compared to the other ones there that are actually quite white and quite clean. This one here is very dark. So we need to explain why that one's gone that colour. There are really two possibilities with this. Either she's got an infection in the base of that tooth, actually in the root, that's causing this tooth to change colour, or she's lost blood and she's lost nerve supply to that tooth.
Okay.
And the tooth's essentially died.
If left untreated, an infection could spread to other parts of the body and even cause life-threatening septicemia.
The only way to know for sure that infection isn't causing this tooth to be so discoloured is to take an X-ray. Right there? Okay, on 3, 1, 2, 3.
In Western Victoria, Chris is looking for clues to why Stephanie the lemur's tooth is discoloured.
Got it?
Yeah, I think we've got it.
The concern is that a severe infection may be the cause.
Now we've managed to get these shots, it's time to look at what we're dealing with. So, this is the tooth we're worried about. Do you see that?
Yeah, it looks completely different to the other one.
Yeah. The moment I see those X-rays, something doesn't quite make sense. It's not what I expected to see. It's quite bizarre actually, because what you're seeing happened many years ago.
Okay.
She's had a root canal. See how the root of this tooth here is that bright white?
Yep.
She's actually had that filled.
Okay.
She's had an injury in the past or an infection to that tooth, which has actually killed all the living tissue inside that tooth.
Yep.
They've had to fill it. At the time, that tooth would have been white. They would never have thought there would be a problem. But as time's gone on, the tooth's actually died because it's got no more living tissue. It's become brown.
Yeah.
It's only just become brown.
Yep, so we've noticed it.
Yeah.
Yeah.
Not for a second did I think this would be the reason that tooth is that colour. The great news for everyone, especially Stephanie, is the fact we do not need to remove this tooth.
So it shouldn't cause her any problems.
I'm very happy to hear that.
It's not what I expected to see.
Didn't expect to see that either.
There aren't many lemurs, full stop, there aren't many lemurs going around with root canals in their mouths.
Yeah.
Now that we know the truth about Stephanie's tooth, there's one more thing we can do for her. Give her a teeth clean.
A clean-up will remove a build-up of tartar and any dangerous bacteria that could cause Stephanie health issues down the track.
Okay. Well done. So, we're obviously not going to be able to whiten that tooth for her, but the good news is that it's not going to be sore. There's no infection there.
Good. Glad to hear it.
We've managed to solve a lot of mysteries in the last few minutes, so now it's time to wake her up. You gonna be all right? There you go, Steph.
Stephanie will spend the next few hours recovering before returning home to the Halls Gap Zoo.
I'm extremely relieved that Stephanie didn't have to have massive surgery today. I would have been even more stressed out, I think, and it just is going to make her transition back at the zoo a lot more easier.
If you guys loved that video, great. Make sure you subscribe to our YouTube channel below. That way.